Here we go, part 5, in the 4th chapter here on tissues and histology in general, and we're now progressing to the connective tissue proper. And in this particular scenario, you see that we're on page 131, and we have this particular presentation here, connective tissue proper, loose connective tissue, also referred to as areolar. Okay, and we have this presentation. This is nice, and I want to remind you of this. Let's just sort of review this for a second. Connective tissue cell, in this case it's going to be a fibroblast. All of the connective tissue proper cells are called fibroblast. They produce a matrix, as you can see, and so we get the matrix from the cell. The matrix will include fibers. In this case, it's going to be a liquid ground substance, so the molecules are not going to be covalently bonded. They're going to be dissolved in water. Okay, so the ground substance here is fluid, as we can see. Okay, how am I doing here in terms of, let me bring this around a little bit like this. Maybe it'll be better. Okay, so this is the idea here, is that, that's good. You can see here that we have collagen. Collagen is the pink. Do you see these big pink bundles going through here? Sometimes they're more wrapped together, sometimes they're a little bit more individualistic, but you get the idea of the pink bundle right there, and that's the collagen representation. We do have some very dark staining, protein-rich little fibers here. This is the reticulin. We do have fibroblasts. Fibroblast nuclei are like little commas or just little dark ants. We don't see the cytoplasm of a fibroblast, but we do see the nucleus. Okay, so we see little more than a nucleus. We also see some other cells in here which are hard to interpret. Let's see if they make the attempt to interpret. No, they don't. Ground substance, again, they're just pointing to empty space here, which is the liquid format. Okay, so that's the idea at any rate. And then we have some other cells that may or may not be easy to identify, and the author is not trying. We do see here this little curlicue right there. That would be an elastin. Okay, so the idea here is that we have elastic fibers, which have a little recoil to them. Okay, so that's the whole thing. Now we're going to be having macrophages, and we're going to be having lymphocytes cruising through here. So mostly macrophages, not so much in the way of lymphocytes, but macrophages will be cruising through, and they will be gobbling up any cell debris, fiber debris. If there happens to be a pathogen involved here, then the pathogen will be gobbled up, and again it's going to be presented on the surface of the cell. So that's the situation with that. Now the invasion of loose connective tissue with adipose tissue is common, and so this is usually included. Here we've identified this as the tissue that will be beneath the skin, so of course the skin moves readily across the underlying muscles and tendons and so on. In the case of breast tissue, we're going to be having the glandular development of milk-producing glands right here. There's going to be individual glands that are separated by a little trabecula of connective tissue. But then in support of all this energetic activity is going to be fat. So that's going to be a common addition to wherever we would be finding this particular thing. There's also going to be, how shall I say, a gender-specific way in which fat is laid down, not just in the breast, but also in the pelvic region for women, and as I said before, in the waist area for men. Men have a tendency to have little love handles or muffin tops over the tops of their their pants and so on. So it's a genetically sort of disposed kind of way in which fat seats itself in the loose connective tissue. Take a look here at the fat cells. What we have is, notice that the nucleus is over here way off to the side. We have a big individual vacuole filled with triglyceride. Okay, so remember back when we were looking at the lungs, it might be easy for you to mistake a simple squamous epithelium of the lungs with the adipose tissue. So take a look, compare, contrast, and see that you can actually not make that mistake so easily. Okay, so they are slightly look-alike, but not that much if you look closely. Do your due diligence and learn the visuals. Okay, so we do have connective tissues that surround certain organs. The testis is one. Over here we have the spleen. It turns out the kidney, again, is an organ in which all of these organs are enclosed by some fairly substantial reticular fibers. And so this is referred to up here as connective tissue proper. And in this particular case, we're going to be seeing it as reticular tissue. So it's another variation of loose connective tissue, but it's the outside surrounding of an organ in order to protect that organ with something substantial. Now we're moving on to another type of tissue. It's still considered, how shall I say here, the connective tissue proper, but in this case we're going to be identifying something that's identified as dense connective tissue, in this case dense regular. Dense regular versus, we're going to be taking a look down here at this panel, and this is going to be the dense irregular. So in both cases they have a similar name, and the only difference is whether it is regular or irregular. In this case we have collagen bundles as the key feature. We do see a little nucleus here and over here, and those are the fibroblast nuclei. And what do we have going on here actually are tendons and ligaments. Okay, so a tendon is what attaches a contractile muscle belly to a bone, and then by definition the ligament is that which connects a bone to a bone. Okay, so the Achilles tendon on the back of your ankle is probably the most prominent and easily to palpate tendon. Also in your wrist, of course, you have some tendons on the medial or anterior aspect, the ventral aspect. Okay, so as you can see here, we have tensile strength in a particular direction. Another detail of the collagen here is that it's polymerized into very, very, very long threads, and that it's woven together along this pathway, right? And it provides the tensile strength in a particular direction. So compare that to this, which is actually a woven. I don't like the stain here because they should have used the same stain so we can compare. But anyways, here we have a fibrous joint capsule, and there's other forms of this. It would turn out to be that your meniscus as well as your intervertebral disc are made out of this dense irregular type of tissue, dense irregular connective tissue. And the idea here is that it's woven, and so it's very it's a very strong textile tissue, and only the fibroblasts really know how to do the weaving. It's not something that we can accomplish through surgery.